Good morning, everybody. Welcome to this session, which is the mental health nurse, and we're going to cover the community health and wellbeing practitioner induction. So the aim of this session really is to give you a holistic overview of the standards and what you're actually going to be doing. And we're going to be looking at some of the teaching and learning material, just so we're very clear about what's expected from you as an apprentice and the support in which you're going to receive. So before I talk, or before we go into a deep dive regarding some of this, what I want to do is just kind of talk about the job role itself. So we're happy with that. We're in the kind of right role to undertake this. So first of all, you should be working in partnership with the people in which you're looking after. So what I mean by that is you're co-producing care with them. So you're looking at some of their strengths, their weaknesses, and that may be looking around social prescribing. It could be looking at how you're supporting them to manage their health, so their physical health. So that might be through medication or through exercise or through diet or through government initiatives such as alcohol reduction programs, smoking cessation, or eating 5 a day, or keeping active, 0 to 5K, or it may be programs around their mental health. So that could be things such as accessing the IAP services, Health in Mind, psychology, counselling, or just maintaining their medications so they don't dip. Equally, you should have an understanding of somebody when they're going into crisis. So for them, what does it look like for ill health? So what does physical ill health look like? Or alternatively, what does mental ill health look like? So what does a crisis look like? And then on top of that, you should be able to kind of understand their safety plans and network plans to kind of make sure that they're well looked after. So that's the big helicopter tour of the health and wellbeing worker. Now, the role in which you could be working is a variation here. You could be working in residential care settings, you could be working in nursing home settings, you could be working in domiciliary or home care settings, or indeed a hospital setting. And that's because it's a broad role. Everybody needs health and wellbeing. You may not even be in a health and social care setting. You may be working in retail or hospitality. And that's because at one time or another, we all need advice and guidance and support to manage our health and wellbeing. So ideally, you should be addressing the causes of poor health and wellbeing across a broad sense of illnesses. And what we mean by that is you're taking a holistic approach, so the whole person approach. So you're looking at how their physical health affects their mental health and wellbeing, and how their mental health wellbeing affects their physical health and wellbeing. And that could link into family, employment, and work. Equally, you'll be working with the individuals to signpost them into groups or communities and identify what really matters to them. So a bit of behavioural science is going on here. And by understanding what matters to them, by putting them at the centre of what they do, you're almost in a situation where you're facilitating health and wellbeing. So you're signposting them. So that social prescribing model comes in quite well here. And ultimately, if we look at some counselling models around acceptance and commitment or solution-focused therapy, and you'll learn that as you go through this, you'll accept the fact that actually we're not here to tell people what to do, but to give them the tools to kind of manage that themselves. Equally, you should be able to understand what's around you locally. So you should be an expert within your local area. So what are the charity organisations? What do the hospitals offer? What do primary care offer? And what does secondary care offer? Where are your IAP services? So that's your access to psychology and therapy. And again, what online resources are there? Finally, you should be able to identify gaps within services and then look at the resources that you need. So that could be using your phone, so looking at apps, AI, technology, online, CBT, workbooks, self-help stuff to bridge that. And then finally, you'll be looking at building those relationships with local organisations and groups. So the community health and wellbeing worker really is about enabling individuals to access the support in which they see as a priority to them. So if they come to you and they're saying they don't feel well, maybe their priority is going to their GP to have a look, or maybe they need to go to a walk-in centre. So it's about you signposting what's important to them now. And there's a great technique out there in NICE guidelines for adolescents and children's services called Davis structured interview techniques. And it's all about logging on with somebody. And if you said to somebody, look, you know, what's the most important thing I can do for you today? Or how can I help you today? What's the most important thing? They'll tell you, and then you do that and you empower them and work with them a bit quicker, and you get to where you need to go. You obviously work with a lot of autonomy. So when you're working with people, it very much is on a one-to-one. So you need to make sure that you're supported with that and that you can work within your local policies and procedures, and you're able to promote health and wellbeing. You should be able to manage some data and accurate records. So when we talk about managing data, we normally do a thing in psychology called the SUD score. So that's the situational units of distress. And basically, by saying to me, you know, if you were to grade yourself between 0 and 10, 0 being I'm not in any pain, 10 being I'm in pain, how would you grade yourself? And they say maybe 7 or an 8. The next time you talk to them, you'll be able to grade them. And hopefully what you'll see over time is that that data's coming down, and that the interventions in which you're prescribing or working with is working, and therefore you're reducing the level of distress that somebody's in. Equally, if somebody was in a high level of distress, then hopefully we wouldn't leave them there. We would do some therapeutic work. You'll be able to use a range of behavioral science techniques. So that's developing your skills and confidence around using some of those techniques. So crisis plan, safety plan, motivational interviewing, acceptance and commitment therapy, cognitive behavior therapy and stuff like that. So we'll look at some of those techniques and how you can use them in your everyday role. You'll work alongside people to ensure that issues around equality are being dealt with and people are able to access the service. Ideally, you'll also identify barriers. So you'll look at things why people aren't necessarily coming to you, or if you're looking at your data, is it more a particular age group or a particular type of person? And then finally, you'll work more collaboratively with your primary healthcare and secondary healthcare. So what does a day in a life of a community health and wellbeing worker look like? Well, you could be working with people on a one-to-one. You could be working with people in a group setting. You know, it's entirely down to you. This is a very diverse role. You'll definitely be able to liaison in with the NHS and local authorities, because ultimately you're going to be doing a lot of referring on. You're going to be doing a lot of signposting. So you want to know what those referral pathways look like. So whether you're referring somebody for Counselling Plus or whether you're referring somebody for Health in Mind, you need to know what that looks like and where to go. You'll obviously work with other organisations within your boroughs. So wherever you're working, there are different organisations such as Healthwatch, and you'll be able to use Healthwatch as a networking opportunity to pass people on. You can be paid or in voluntary work for this, so it doesn't necessarily have to be all paid work when you're doing your support work around psychological support. And again, you may be working with local authorities or wellbeing services such as lifestyle services or IAP services, which is that's improving access to psychological therapy. You'll definitely be able to have really good digital skills. I think a lot of digital skills is where we're going in supporting mental health and wellbeing, because everyone has a phone and an app, and it seems to be that's the way the world's going. So really understand that. And again, you may be, as I said earlier, in a private sector, retail firms or local businesses, and you're just looking for managing that staff sickness and that retention piece. So when we look at the community health and wellbeing practitioner, there are 10 duties in which needs to be managed. And these 10 duties are the things that you're going to learn each month. So we do one duty a month. And each month it's quite fast paced. You'll log in online, you'll cover the skills and the knowledge. You'll have a multiple choice test, a short written case study of 500 words, and then we move on. So it's quite fast paced. And then on top of that, we'll have our Zoom sessions where we come together and we try to do some behavioral science work. So we learn those skills in managing distress. We talk about safety plans, we talk about crisis plans, we'll talk about managing suicide and ideation, and we'll look at just some basic things around social prescribing. So that's what we'll do there. So let's just now do a dive into those 10 duties and what you'll be doing each month. Now, we have produced a guide for this standard, so please make sure you do follow that guide, because each month it does tell you what you're going to be doing throughout that process. So duty 1, you're going to be looking at preventative approaches to promote the health and well-being of individuals. So preventative approaches is all about government strategies that are already there. So really understanding about health promotion and psychoeducation, because I know it feels like we don't have a lot of support out there. However, that's not the case. There is an overwhelming amount of support out there. You just need to know where to find it. So, and what we're talking about is, for example, that 0 to 5K, the eating 5 a day, the alcohol reduction, smoking cessation. There's substance misuse services, there's gambling addiction services. So there is so much out there, it's going to be quite overwhelming. What your job will be is to look at those preventative strategies and see how you can embed that into your current workforce. Duty 2 then looks at helping communities to build local resilience. And what we mean by local communities and local resilience is understanding the demographics and where you live. So, for example, if you're in an aging population area, how do we support that local community to understand things around digital skills and digital poverty, etc.? It may be that you're working within London, and therefore you've got lots of different community groups, and therefore it's working within those community groups to identify and reduce stigma around discrimination of mental health, or maybe you're looking to raise awareness around the LGBT+Q rights, or whatever it is. So it really is about understanding your demographics where you are, because ultimately where you are is where you're working, and it's that local community which has the local networks. So it's really important to understand your local community, and it's really important to understand what resilience looks like in your local communities and how to build those relationships. If we then look at duty 3, it's about providing informed advice about local services and projects and health and well-being. So at this point, you're becoming a social prescriber. And what social prescribing is, it's about listening to what the person's problems are, and then identifying appropriate solutions to support that. So, for example, if somebody's sitting there saying to you, you know, I've got debt worries, I can't pay my bills, I can't access food, then you've just heard a couple of things there that you might be able to help with to reduce their anxiety. So, for example, who are our local food banks? What are the local charities and organisations that can help? If it's about debt management, who are the national organisations? So, for example, like Money Matters or Turn to Us, have they had a benefit review? So there's lots of things that we can do to help somebody improve their mental health and well-being without medicalising it. And what we've seen over the last couple of years is a massive increase in the search for medication to help with mental health conditions. And actually, we've over-medicalised normal problems. So looking at how we can do that is where we need to be. So that's about you understanding the social prescribing. Duty 4 looks at managing referrals. Now, this is really important because each service that you refer somebody to has their own referral pathway. So, for example, if you were to refer somebody for an eating disorder, they would need to go to their doctors, they would need to have a set of bloods, they would need to have their BMI done, they would need to have an ECG, and then the doctor can do the referral. So it's not as simple as just saying, I think you need this service. Sometimes there's a long road in, and even then when you're there, you then may have to wait a long time for that service to actually kick in. So at that point, it's going to be how you hold that person, what support are you going to put around them to help manage them during that difficult time. And again, some services you can refer to, some services is self-referral. So just understanding referral pathways to those key services in your local area is really important. So for example, the IAP services are normally self-referral. A lot of people think they have to go to their GP, but the GP can do it, but then you're having to wait an appointment. So by the time you've got your appointment, you're probably 3 weeks in. Substance misuse services, for example, a referral to them can take a long time through the doctors. And a lot of those services prefer the individual to do it themselves because the first step in recovery is admitting that you need the help. If they're self-referring, it shows the screener that's assessing their application that they're ready because they've made that difficult step. They're not being pushed into it. So actually, sometimes having those discussions with people is really, really helpful. Duty 5 looks then at behavioural science to help people find practical solutions. So here, we're going to look at some therapeutic approaches. So you'll be trained in some basic principles of therapy. So the basic principles of therapy in which we're going to look at is acceptance and commitment therapy, because I think that's a great set of therapy skills. And acceptance and commitment therapy really is what it says on the tin. It's about the person accepting the situation that they're in and then committing to change around it. Because ultimately, people either overthink or they're not thinking enough, or they're just not at the point where they've accepted the situation. So they're unable to move on because they haven't actually accepted the situation they're in. And then the commitment is the fact that you create steps to achieve that. So that's acceptance and commitment. We then have solution-focused therapy, and solution-focused therapy is problem-solving skills, basically. So sitting down with somebody going, right, let's put your problems on a piece of paper, and now let's work out how we reduce some of these problems, looking for some answers. And that might be referrals, that might be social prescribing, that may be medication management, whatever it is, but we work those steps through. And then finally, we'll do some CBT, cognitive behavior therapy, because ultimately we need people to understand how they think and feel. And the example here that I normally give to people is, imagine you're walking down the street and you've gone into you've passed a shop window and you see an item of clothing that you really like. Now, somebody that's quite impulsive will just go, oh, I need that and I have to have it. They'll either go and buy it straight away without thinking, or they'll walk away and it'll be the only thing on their mind. Until they buy it, the mind doesn't switch off. Ultimately, both of those processes cause a high dopamine reward system in the brain. So the brain goes, I need it, I need it, I need it. It releases the dopamine, it makes them feel happy. And when they buy it, they're then happy. So the thought is, I need this to make me happy. The brain then releases the chemical for them to be happy. And then the behavior is they then buy it and then they do it again. So understanding how our thoughts release the chemicals in the brain to make it a feeling, and how those feelings then cause us to act in a certain way, is really important. And if we want to break cycles, we have to break some of that thoughts, feelings, and behaviors. There's lots of simple worksheets that you can do with somebody, lots of self-help guides and lots of apps there that you can do as well. So we're not turning you into Freud Sigmund overnight, but we are definitely going to be equipping you with some basic skills just to help people to see on paper how busy their mind may be looking. GT6 looks at the implementation of actions set out in national policies to promote health and wellbeing at community levels. So here we look at local government agendas or local county councils' priorities. And that may be based on certain demographical information. So for example, if you live in an area of high unemployment, statistics and evidence would normally suggest that there's a high level of substance misuse, and therefore you may have access to more substance misuse services than an area of the country that doesn't have that problem. And therefore, the advice and guidance around that is very different to somewhere else. So understanding your local community's problems, social problems, will give you an idea about the consequences of health and wellbeing. Because ultimately, if you are in an area maybe where it's called a food desert, so in other words, you can't access high quality fresh fruit and veg cheaply, what you tend to find is there's a lot of takeaways. We call that a food desert. And in a food desert, people will normally just eat takeaways because that's all they can get. The risk to that is obesity, strokes, heart attacks, weight gain, all of this stuff. All of that then causes feelings of low self-worth, low self-esteem, depression, anxiety, sleep problems, etc. So it becomes a real vicious circle. So understanding that and trying to break some of that is where we need to be. Duty 8 then looks at managing data and information, so evaluating your projects. So that's about doing your self-assessments, what does that data look like, has becoming a community health and wellbeing worker helped, are you reducing stigma, what is it that you're hoping to achieve from this role, and then measuring those successes. Duty 9 looks at operating with legal and ethical frameworks. So whilst the community health and wellbeing practitioner is a new role, it very much is an unregulated role. So it's not like you're being registered to the British Psychology Society, you're not becoming a registered nurse. You have to work within set principles of ethics, and those ethics and principles are all about truth-telling, doing no harm, remaining professional, the non-benevolence processing, because it's really important that you have some level of professionalism behind you, even though this is a bit unregulated. And what you'll notice that counsellors and therapists, a lot of that is unregulated work. So understanding those legal frameworks and understanding the titles that people have is quite important. And then finally, duty 10 is about you taking your own responsibility around your own professional development and in line with organisational policies and procedures. So, for example, you may have to do a certain amount of CPD each year. If you become a mental health first aider, you have to renew that every 3 years. If you become a first aider again, and you're doing your CPD updates annually. So it's that kind of stuff. And I definitely would expect a community health and wellbeing worker to be a first aider and a mental health first aider, because the two go hand in hand with this title, right? One's health, one's wellbeing. So they're the 10 duties attached to this standard. So what I'm going to do now is we're going to have a chat about the assessment plan and what the assessment plan looks like. So when we complete all the teaching and learning, we go through a process called Gateway. Gateway is where the training provider, the employer, and yourself sit down and go, have we met the skills, knowledge, and behaviours for you to sit the endpoint exam? And we have to put together a certain amount of evidence for the EPAO, so that's the Endpoint Assessment Organisation, to confirm that you are ready for the assessment. So your gateway requirements for this are as follows. You need to have your functional skills at level 2 for English and maths. Now, if you have any neurodivergence, that can be adjusted. So if you do need reasonable adjustments, do let us know and we'll obviously manage that. You'll also have to have a portfolio of evidence. So the portfolio of evidence is the evidence from the online learning material. So we will then download your monthly 500-word case studies. They're already linked to the skills, knowledge, and behaviours. You just need to be able to talk about those in a professional discussion. The portfolio of evidence will contain a minimum of 3 case studies. You're going to have about 10 because it's one per thing. And it'll include evidence of observations and practice. So we will observe you talking to people or giving advice and guidance and signposting, whatever it is there. So we'll do some of those observations with you. And you need to produce a 1,000-word summary. So you're basically going to do a reflective piece of work about what you've learned over those 10 duties. You may include witness testimonies and other evidence of ongoing development to put in your portfolio. Now, once your portfolio is done, we sign it off. It goes against every skills, knowledge, and behaviours, and that's submitted. You'll then go through a process for the EPAOs, the endpoint assessment. Now, your endpoint assessment, the very first one is going to be a multiple choice test. Now, by this time, you would have done 10 multiple choice tests, so you're going to be an expert at this. And the multiple choice test that you have done will be very similar to this because it's going to be linked against the skills, knowledge and behaviours. So you don't need to worry. It's going to have 30 questions. You need to make sure you cover or achieve at least 20 out of those 30 to pass. You'll then have, no, I'm lying to you, it's 24 to pass out of 30. You'll then have a demonstration of practice. So assessment method 2 is an observation. Now the observation is a maximum of 100 minutes. So that's normally an hour for the observation and then 30 minutes for questioning, give or take 10%. Now, what they're going to want to see is you're going to have 3 case scenarios in this observation. So you've got 3 stations. In station 1, it's 30 minutes. You'll have 5 minutes reading to understand what's going on with the patient. You'll have 20 minutes to carry out what it is you're going to do, and then you'll have 5 minutes follow-up. Station 2, it's 40 minutes, 20, 15 and 5. And station 3, it's 30 minutes, 5, 20 and 5. So you'll have 3 kind of case reviews to do in your observation. And those case reviews will be this. So in station 1, you'll have a service user and you're going to work alongside an actor. You're going to meet them. You're going to talk to them. You'll make appropriate notes and you'll put together an action plan and a priority list. So dead easy. Station 2 is a community issue. So this is a base case scenario involving a community group or organisation where the apprentice will work with the independent assessor to action or develop agreed community outcomes, drawing on experiences. So again, looking at what happens. So for example, you might be working with the church and you may be looking at maybe health and well-being. So how can that church improve health and well-being? What strategies could you do? How can you get them to work together? So it may be the fact that you do a talking group with them. It may be the fact that you're looking at government initiatives. And then station 3, again, goes back to a service user issue. And this is where you have then another problem to work yourself through. So it's quite a nice EPA, this one, really, because it's all practical and it's going to be stuff that you're going to be doing every single day over the next 12 months. So nothing too difficult. And like I said, if you've done the duties and you've done the duties well, this will be really easy for you because you're just going to listen to the person. Hi, my name's Steve. What can I do for you today? Listen to what they say, jot down what they say, underline all the problems, and then look for solutions with them and work with them for those solutions. The assessments are done either face-to-face or online. So again, you don't have to go anywhere for that. And then finally, the last assessment method then is a professional discussion. And the professional discussion is based upon your portfolio of evidence. So somebody's just going to talk to you. You'll have a maximum of 12 questions and they'll just go through the evidence which has been submitted. Don't forget, you'll be entitled to reasonable adjustments. And again, the way in which the grading works is the multiple choice test is a pass or a fail. The demonstration of practice is a pass or a distinction. The professional discussion is pass or a distinction. And your overall grade is a pass or a distinction. So if you to get a distinction, you need a distinction in all in the practical and the professional discussion. If you get a pass in one and a distinction in the other, the highest grade you can get is a pass. So just so you're aware of how that works. Now, again, same with the retakes and resits. If you fail one component, you can resit it. You don't need to do any further learning. You can just go in straight away to do that. So a lot of what we're covering here is already covered in that guidance book in which I've written for you. So what I'd like to do now is have a look at the teaching and material for this. So when you log in to your student account. You will come in via Canvas. And in Canvas, you will see on here, you have your home screen. If you hit your home button, it takes you to this page. And on this page, you've got your grey bars that go across. They're your modules. And you can see here, we've clearly outlined what you need to do in each month. So we've called it month 1, month 2, month 3. Hopefully that's as straightforward as it needs to be. Under Welcome, there will be a new bar. It's not there yet because it's hidden. It will be there when you log on, and it'll just say recorded sessions. So each week, there'll be the recordings from the live sessions. It's your job to make sure you watch that session each week, because we cover the skills, knowledge, and behaviours and the practical stuff in those classes. Announcements appear on your right-hand side, so under your to-do lists. Click on those, read them, because that's how we talk to you on a weekly basis. Assignments, if we click on assignments, these are the assignments that you need to do for the EPAO, for the portfolio for your EPAO. So again, you'll click on there, have a read of those, and you just work through those assignments. It's really straightforward. Discussions, if you click on discussions, each week after a video, I'm going to ask you to discuss the material that you've learned. So there'll be a simple question such as, in duty 1, you learned your roles and responsibilities. Tell me, what would you, or how do you see this working? You're just going to write. There's no right or wrong answers. It's just your reflective space. Grades, if you click on grades, as you submit your work, I will be marking it and I'll be grading it. And what the grades do, it pulls together an overall grade. So it's a weighted grade. Now that grade doesn't mean you're going to get a pass, merit or a distinction at the end. It's a predictive grade to let me know whether you're working at a pass or a distinction level. People are the people in your group, so you can network with those people in your group. Pages, you don't really need to worry about pages. They're just the pages of the course content. Files is where you can go, and it's the library. So it's where all your course books are, all your reading material. But again, they are in all the modules. So ideally, just follow the modules all the way through. Syllabus is the syllabus. It just outlines the framework. We don't do quizzes because we do assignments. The modules just then takes you back to here. So the way the module works is you go to Welcome, you click on the first one. You can see it gives the drop-down list. You've got a little circle here because it says you must complete all items in order. As you go through it, you get a tick, a green tick. Now, what will happen, and what basically happens is I get apprentices contact me going, Steve, the system's not working, I can't do the test. And I go, have you clicked through every page? And they go, yeah. And when I log on, they haven't. So please make sure that when you do this, for example, you can see, look here, there's only one green tick. So only that one page has been looked at. Before you can sit this exam, you have to click through each page. So all you do, you start at the top. Up comes, there's your reading material for this one. So that's the book that we've written. You're going to hit next and you just work your way through. So you can see here in duty 1, you've got the knowledge and skills. The syllabus is written in line with the knowledge and skills. You just click your way through that. And then what will happen as we go back, you will see that gets ticked off. So as you go through it, we know how far through the program you are. So it's just a little marker there. Now, obviously, the program is designed to be 10 months in learning. And that's because the last 2 months, it's going to be EPA preparation. So we want all of the learning done, and then we can do your observations and your portfolio. So it's 10 months of solid learning, each month a different topic, a different skill and knowledge. And in the last 2 months, it's about preparing your portfolios. And obviously everything is then pulled off and then submitted. Calendar's there. If you need to email us, you can email us internally through the system here. And then you can also go back to your dashboard. Now, in your dashboard, just so you're aware, you will have several modules. Now, this is my screen, so please don't panic. But what you will have your induction, your welfare and well-being. So the induction is, well, it's an induction, right? It's welcome to your apprenticeship. This is all the things you need to know. Your welfare and well-being is all about your rights as a learner. You will probably have to do functional skills level 2, so that's your functional skills 2 class, and then you will have your community health and well-being. So you will have 4 modules in your screen. So once you've completed the apprenticeship, that's it. Once you've completed it, the welfare, that's it. We would expect you to complete your functional skills within 6 months, then it's done. And then it's just the case of concentrating on the rest. Okay, so that's what happens. Now, it's really important to say, and I'm going to show you this one because I know Lisa won't mind me showing you. This is my screen, so just bear that in mind, what I'm going to show you. We know whether or not you're logging on or not. So here, it comes up with your essays, your grades, your predicted grades. And then when I click on your name, I can go to your student grades, your report, and your access report. So if I go to your access report, I can see how many times you have logged in that month or that week. And this report is what we need to prove that you are in learning. Okay, so it's really important that every single week you're logging on for at least 5 hours, reading the material, taking part in the discussions, leaving your comments. It's 1 hour, less than 1 hour a day. You can fit this in your lunch break if you need to. You know, and I appreciate how difficult it is to work and study. However, it's a unique opportunity to be given this qualification fully funded, and you need to take this opportunity for everything that it's got. By you committing to this, you'll improve your study skills, you'll improve your better behaviours if you want to then advance onto a high level, if you want to go to management, if you want to go to nursing, and you learn these behaviours now, it's going to be so much easier for you. We will chase you if you're not logging in, because you have to be logging in and you have to be participating. So no different as if you were going to a classroom on a weekly basis. You still have to be engaging in the same way as if you were doing it face to face. And like we said, our learning and skills mentors will be chasing you if you're not doing that. So just to summarize everything then, we've gone through what the apprenticeship is. We've looked at the 10 duties. We've covered the assessment plan. And I've shown you how to use the Canvas material. So that's all we're going to cover in today's session. Hopefully you found that really useful. And I will see you online next week when we look at duty 1. Take care for now. Bye, everyone.